over 60. These common nuts may be hurting your heart and brain, and most people have no idea. If you snack on nuts thinking they're always healthy, this video may surprise you. Because after 60, your body processes fats, minerals, and toxins very differently than it did years ago. Some nuts can support your heart, sharpen your memory, and protect your bones. But others, especially the ones sold as healthy snacks, may quietly increase inflammation, interfere with medications, and even affect brain function over time. Today on Dr. Health Blog, I'll show you which nuts seniors should eat more often, and which common nuts you should seriously limit or avoid to protect your heart and brain as you age. Stay until the end, because the number one nut on this list is one most people eat every week, without realizing the risk. Nuts seniors should eat. Nut number 1. Almonds. Almonds are one of the safest and smartest nuts for people over 60. They're rich in magnesium and vitamin E, two nutrients that help protect blood vessels and reduce oxidative stress in the brain. Magnesium also helps keep calcium where it belongs, in your bones, not your arteries. That's important because stiff arteries increase heart disease risk as we age. Almonds also provide fiber, which supports digestion and helps manage cholesterol. Best way to eat them, raw or dry roasted, with the skin on if chewing is difficult. Sliced almonds or unsweetened almond butter work just as well. Nut number 2. Walnuts. Walnuts are one of the best nuts for brain health after 60. They're rich in plant-based omega-3 fats that support communication between brain cells. As we age, those connections naturally weaken. Walnuts help slow that process. Research shows older adults who eat walnuts regularly perform better in memory and thinking speed tests. They also support heart health by improving blood vessel function and lowering inflammation. 7 to 9 walnut halves per day is enough. Keep them refrigerated to stay fresh. Nut number 3. Pistachios. Pistachios are especially helpful for heart health in seniors. They're high in potassium and naturally low in sodium, helping balance blood pressure. Even a small reduction in blood pressure can significantly lower heart disease risk after 60. Pistachios also contain antioxidants that protect eye health and support circulation to the brain. Another benefit? They're easier to chew than many nuts, making them a great option for sensitive teeth. Unsalted or lightly salted varieties. Nut number 4. Brazil nuts. Brazil nuts may be small, but they're incredibly powerful. They're the richest natural source of selenium, a mineral essential for thyroid health, brain protection, and immune function. As we age, selenium levels often drop, which can affect energy, mood, and memory. Just one Brazil nut per day provides enough selenium to support your body. More is not better. Stick to one nut daily. Common nuts seniors should limit or avoid. Nut number 1. Peanuts. Peanuts are one of the most commonly eaten snacks, but they're not ideal after 60. They're prone to mold contamination, which can stress the liver over time. They're also high in omega-6 fats, which may worsen inflammation, especially if you already deal with joint pain or arthritis. Most peanut products are heavily processed with salt, sugar, and unhealthy oils, which can raise blood pressure and blood sugar. Nut number 2. Cashews. Cashews may taste smooth and creamy, but they can cause issues for seniors. They're higher in carbohydrates than most nuts and can raise blood sugar more quickly, especially concerning for people with diabetes or prediabetes. Cashews also contain compounds that may interfere with calcium absorption and kidney health when eaten frequently. Nut number 3. Macadamia nuts. Macadamia nuts are extremely calorie-dense and high in saturated fat. For older adults, this can contribute to weight gain, higher cholesterol, and added strain on the heart. They're also very hard, which can be uncomfortable for sensitive teeth or dental work. Enjoy them occasionally, not daily. Nut number 4. Pine nuts, most risky after 60. Pine nuts may look harmless, but they can be problematic for seniors. They've been linked to taste disturbances that reduce appetite, something that can lead to unintentional weight loss and weakness in older adults. More importantly, pine nuts may interfere with how the body processes certain medications. If you're taking prescriptions for blood pressure, cholesterol, or blood sugar, this is a serious concern. For most seniors, it's best to avoid pine nuts or speak with a doctor before eating them regularly. After 60, even small food choices can have a big impact. Choosing the right nuts can protect your heart, support your brain, and help you stay independent longer, while the wrong ones may quietly work against your health. Let me ask you, have you noticed certain nuts make you feel better or worse? Share your experience in the comments. Your story could help someone else. If this video helped you, like, subscribe, and turn on notifications for more simple, science-backed health tips here on Dr. Health Blog. Take care of your health, and I'll see you in the next video.